Okay, thanks, Luke, for the warm introduction. Hello, everyone. I know that it's pretty late in the day, and it's been kind of a long day, so I'll try to keep it light, and I'll try to keep it fun, if that's okay with everyone. So I'll start off with an exercise, and don't worry, I'm not going to make anybody stand up. I'm not going to make anyone raise their hand. It's just a mental exercise. So I want you to think back to the first time, sort of the first scientific concept that absolutely blew your mind. Maybe you were thinking about it for days, you were obsessed, it's all you wanted to talk about, and everyone was tired of hearing about it. And I know this is kind of a strange question, so I'll give you a couple of examples from my own experience just to kind of jog your memory. So the first example is when I was probably 14 years old, my father came to me and he handed me a popular science magazine. And he said, I forget exactly what he said, but it was something to the effect of, you know, the future is in here, you should probably read this. And so, probably more reluctantly than I'd like to admit, I took it from him, I opened it, and I almost immediately found this. So this is a 600-ton sphere that is hanging in one of the world's tallest buildings in Taiwan. And what it does is it kind of, it isolates the building from the natural rocking motions that happen during earthquakes and storms. And as I found out later, this isn't a new concept. This has been around for a long time. It's called a tuned mass damper. But for me, it was brand new, and it completely opened my eyes to what's possible and what people are doing in this one corner of science. And so that prompted me to want to be a civil engineering student, which I was in college for about 3 weeks. And then, so I want to change gears a little bit and talk about research because that's kind of the focus of the presentation. So the second example I'll present came from when I actually started doing some pseudo-independent research in college. So it was about 6 years later. I know this is a beautiful picture, but this is what the lab that I was working in was working on. What it is, it's a tiny, tiny droplet. It's 100 nanometers wide, or 100 nanometers in diameter, and it's actually a water droplet inside of an oil droplet, which is inside of water. And the only reason it stays together, the only reason it doesn't just phase separate right away, is it has these really cleverly synthesized peptides that stabilize it. And so it's cool for a bunch of reasons. It's cool because you can put one drug in the water part, you can put another drug in the oil part. So you can deliver like multiple drugs at once. But it's also cool because you can leave it on the shelf for months. You can squeeze it, you can inject it, you can pipette it. They really don't break down. They're really stable. And that stability is governed by the same types of forces that keep buildings in Taiwan standing. And so this absolutely blew my mind. I couldn't stop talking about this. I think everyone was absolutely tired of me at the end of the first week. But I guess that was really kind of a source of inspiration for me. And so I don't really know what to call this feeling, and I think hopefully by now everybody's thought of their own experience, or you think I'm completely crazy at this point, but I want to call it something, so I'm going to borrow a word from my friend and colleague George and call that feeling of discovery jelly. And so doing research for me has always been about chasing this jelly, and I think that's probably true for everybody here. So increasingly, it seems, though, that for researchers, there's a lot that's getting in the way of this feeling of chasing jelly. So specifically, to do research these days, you have to compete for an ever-shrinking pool of resources, and there's a lot of consequences associated with that. But the biggest one, and the most alarming one for me, is that it can dramatically change what you study. It can dramatically change what you focus on. So you'll see researchers start to chase granting trends, or maybe they'll seek commercialization before it really makes sense to, or maybe they just become increasingly risk averse with what they propose to study. But in any case, I think because this profoundly affects what we study, that takes away from the jelly that we kind of chase. And so what I want to present to you guys, and I promise I'm getting to my point, is a mechanism that actually kind of embraces jelly, and it doesn't reward conformity, it doesn't reward risk aversion, but it actually highlights these really exciting projects, and that's science crowdfunding. And so what we're starting to see with science crowdfunding is a lot of interesting research come through from sources that we would never expect. And even when they do come from traditional sources like academia and industry, they're starting to take different paths, which is interesting. And so if we're really here to talk about making science broader, and my interpretation of that is that ideas, technologies, people can come from all different backgrounds, then I think it's worth talking about science crowdfunding. So what I want to quickly present is just how it works. I know that this has come up a lot this conference, but I actually want to give some context for how the process actually works. So the first step, if you're a researcher and you want to crowdfund a project, is to define the project. So define the scope, the budget, exactly what's going to be involved. The second step is to put it online and to raise awareness for that project, really showcase the jelly, convince people why it's so interesting and why you're passionate about it, and leverage that for funding. And the third step is obvious. It's to do the research and then to openly share the results with everyone who supported you. So what I want to present are kind of two examples of projects that are relatively non-traditional, that were enabled through crowdfunding and otherwise may not have gotten to where they are today. So the first example comes courtesy of these two. This is Laura Andrews on the right, and Kelly Zabrowski on the left. And so they are co-founders of a small biotech startup called Azurite Technologies. And Azurite's mission is to develop a completely non-invasive, continuous blood glucose monitoring system. And obviously this is a really competitive space, but the technology is promising. And so the first thing that a team like Azurite Technologies would do in the US is typically apply for an SBIR, or a Small Business Innovation Research Grant, which comes from the NIH, which is a federal funding agency. And so just like with other NIH funds, this pool of funds is shrinking, and so it's incredibly competitive, and it's by no means guaranteed to get an SBIR. But so in addition to that, it's also incredibly slow. If you applied for one today, you might be waiting 10 months or more until you actually got the funds to do the work. So what's really interesting about these two is they were kind of creative in finding a way to fight that slowness. And so what they did is they went to experiment to crowdfund almost $8,000 for some really basic prototyping and development. And this was basically so they could collect some early data so that they could supplement and continuously improve their SBIR application. So what starts happening is they're doing research in parallel with writing grants. And so as they collect data, they can iteratively improve their applications and really speed up the process. And so you don't have this period of grant writing followed by research in their case, but these processes happen in parallel. So if we're talking about speeding up how we do research, this is a pretty cool example. And so I got to talk to Laura recently, and I asked her two questions that were on my mind, and I imagine on a lot of your minds today. And the first one was, is this enough money? This is only $8,000. An SBIR will get you $150,000. That's orders of magnitude more. And her answer was yes and no. Yes, in the sense that they got to collect the early data they needed to really iterate on their proposal, improve it, and ultimately get it. But the answer is no, in the sense that this didn't pay for lab space and it didn't pay for salaries. So they had to get creative, as most entrepreneurs do, and they ultimately ended up borrowing for free some lab space. The only catch is that the lab space was in Montana. And so I don't know if you know much about Montana, but it's pretty far off the beaten path. And so, but I guess as a startup with their backs against the wall, that's what they had to do. So Laura and another engineer are now in Montana working on this problem on kind of a shoestring budget. So the second question that I asked her was, why didn't you seek investment for this? Why not raise funding from investors? And the answer she gave me was, at that point, it was just too early. There's too much risk involved. They really weren't comfortable with bringing on a whole new set of stakeholders. And so this was kind of a perfect medium. It was sort of a non-dilutive, small source of capital that really sort of pushed them forward. So just quickly, I want to show this slide. This is, each one of the circles represents one individual that supported their project. So in this case, it's 83 people at an average contribution of $95. So you get a sense that this is a pretty big group effort. It took a lot of people to make this a reality. Okay, so that's it for that example. The second one I want to talk about is also really cool, and it's perhaps even less traditional. So this is Sonia and Eric, and until 5 years ago, Sonia and Eric were not biologists. And so what happened 5 years ago, in 2010, the story actually starts with Sonia's mother. Sonia's mother's neurological health began to decline really rapidly, and they actually had no idea as to why. They didn't figure it out. They didn't get a diagnosis until after Sonia's mother's passed. And ultimately, they found out the cause to be fatal familial insomnia, or FFI. FFI is a prion disease, and you probably all know prion diseases because mad cow disease is a prion disease. And so how they work is a prion protein, which is a protein in your brain, becomes misfolded. And then as soon as it becomes misfolded, it triggers neighboring proteins to also become misfolded. So you get this really rapid chain reaction of misfolding proteins, really rapid cognitive decline. And so the story doesn't stop there. As I mentioned, or maybe I didn't, it's a genetic disease. So they also had Sonia tested, and it turned out that she had the mutation as well. So I promise the story gets a lot more positive a lot more quickly. So Sonia and Eric basically changed careers, and they devoted their entire lives towards tackling this problem, towards fighting this disease. So one of the first things they did is they created a blog that aggregated any and all information about FFI and about similar genetic prion diseases. They also formed a nonprofit so they could effectively channel funds towards research. And finally, they formed this really cool collaboration, which is what I want to talk about. There was a researcher in Germany who had a really promising drug compound for FFI. And there's a researcher at the University of Chicago who had an animal model of FFI, a mouse model. So what Sonia and Eric did is design an experiment to test the drug compound in the animal model. Now, in order to fund this, they turned to experiment, and they ended up raising just over $17,000 a little over a year ago. And most of those costs went towards paying for actually housing the mice. Animals are pretty expensive. And paying for some technician support at the facility. And the part that I really want to highlight is that this was a collaborative effort. So the researcher with the drug compound, the researcher with the mice, and then Sonia and Eric catalyzing the whole process. They were really the driving force behind it, and they also provided the funding. So again, I'll just quickly show this slide. In this case, there's slightly more people, 101, and this time it's $170 per contribution. So, but again, you get a sense of how many people kind of the story affected and contributed to the project. So just to kind of wrap up this whole story, to give you a sense of where it stands now, Sonia and Eric published this update, this piece of science, as towards the end of their project. And so what you have is the yellow line, which represents the mice that were given the experimental compound, and the blue line, which represents mice that were given a placebo, so control. You can kind of see that there's no real difference between the yellow and the blue lines, and there's no real difference in survival times between the two mice. So in this sense, it was a negative result. But Sonia and Eric weren't deterred at all. In fact, they're more determined than ever. And just 2 weeks ago, they gave a talk at a conference that outlined their whole decision to crowdfund, what went well, what didn't go well, if they'd do it again. And I've retweeted that, and I put it on the top of sort of my Twitter profile. So if you want to see it and follow up on the story, I encourage you to check it out there. OK, so the next logical question is this all working? Are those two examples just anomalies, or are they actually representative of a much broader pool of research projects that are out there kind of waiting in the weeds? And so to give everyone a sense of scale, I wanted to provide just some quick numbers. So Experiment was founded in March of 2012. Since then, we've raised just over $1.2 million for the 214 research projects you see down there. We've had 10,000 backers and then 2,000 of these cool science-based updates from the work. And so just to kind of start to wrap things up, I want to kind of tie these examples to the main question of this session, which is how can we actually make science go faster, and how are these precedent-setting examples to that end? And so to the first point, one question we get all the time is, how are you actually going to increase project goals? How are you going to enable projects to raise more money? And while that's important and that's a precedent that we need to think about how to set, if you look at the two examples we just went over, they were able to make some pretty meaningful progress with relatively small amounts of money, certainly a lot less than we would expect. Even if that progress means moving towards another funding source that'll keep the project alive, as in Laura's case. And so the question I have for everyone in this room is rather than thinking of how to make project sizes bigger, how can we think about continuing to reduce costs, reducing the costs of doing research? In both of these examples, they benefited from having external labs support them. So one of the biggest costs of doing research was taken out. And so there are obviously a lot of ways we can reduce costs technically, but can we do it using sort of creative collaborations and creative partnerships? Maybe it's an injection of capital, a small injection of capital at the right time for the right project. Maybe it's giving them the resources or lab space they need. Whatever it is, can we continue to sort of look outside the box and find these interesting projects? And the second one is if we're able to do that, I think we're going to start to find a whole slew of projects like these that can benefit a lot from a small amount of funding. And so at that point, we're going to have this really interesting problem of this huge pipeline of research that'll somehow have to be organized. And so I'm actually pretty excited for Experiment's role in kind of centralizing all that information as this kind of non-traditional pool of research grows. And then the third point, I almost hesitate to have it on the slide just because it sounds so ridiculous. So jelly-driven research, how do you even quantify that? But I firmly believe in this, that if we make jelly the focus of doing research and not just an occasional byproduct, then that's how we'll really see ourselves speed up and our pace of progress increase. So that's all. Thank you.